Risk management education has come to mean a number of different things. At Law and Medicine, we believe it means providing answers to the medical legal dilemmas that clinicians face. What is the liability for a physician who provides a curbside consult? When is it acceptable to use a drug that has a black box warning? How much documentation is enough? And what is the standard of care when there are conflicting studies in the literature? These are the questions that physicians face, and the answers are what Law and Medicine provide.
Every day when I see patients, issues arise as to how decisions are made. And then as a physician, you have to apply what the patient wants with what you feel is medically justified.
And so that's where a lot of these modules of Law and Medicine, you start reading them and you realize how it applies to what you're doing on a daily basis.
Victor Cotton received his medical degree from the Pennsylvania State University. He completed his residency training in internal medicine on the Osler service at the Johns Hopkins Hospital. He then received his law degree from Widener University.
I started my career as a physician, and what I learned about medical legal education 25 years ago is still true today. Most of the material is created by authors and speakers who've never seen a patient, and although their hearts might be in the right place, much of what they recommend just isn't practical. It doesn't work at the bedside, and it won't lower your risk. And I think it's time for that to change.
Dr. Cotton has practiced and taught both law and medicine. Spending 8 years as an internist and 10 years as a healthcare attorney, he is an experienced speaker and educator and has received Professor of the Year awards at both the medical and law schools where he has taught. Dr. Cotton is uniquely qualified to parse the confusing and sometimes conflicting medical legal risk information and distill it into practical, effective risk reduction training materials.
Did you advise me? No. Did you examine me? No. Did you treat me, prescribe, adjust my medicine, order a test? You didn't do anything. Simply scheduling an appointment does not create a doctor-patient relationship, does not create a duty, does not step you into any legal jeopardy, okay? You got my name, my address, my insurance, my social, none of that. You're not practicing medicine yet. You're getting ready, but not yet, okay?
It has always seemed to me that the material that comes from an attorney is always missing that key element. And if you have a physician attorney that lives in both worlds, it really makes the communication so much more powerful, and I just get so much more out of the presentations for that reason.
What Victor's modules do is allows us to really pick out and choose the module that applies to us, dissect through it, which is very concise, it's precise, and then within that is the tools that we can then apply to our clinical practice.
I've practiced medicine and I've practiced law, I've been in the exam room and I've been in the courtroom. I've done hundreds of presentations and I use the same simple approach every time. I start by explaining the relevant legal principles in a way that everyone can understand, and then I demonstrate how they apply to scenarios that physicians face every day.
Our educational materials have a unique advantage of being CME accredited by 2 entities. Law and Medicine is recognized by the Accreditation Council for Continuing Medical Education and is able to designate our materials for AMA, PRA Category 1 credit. Our materials have also been approved for prescribing credit by the American Academy of Family Physicians. Law and Medicine's online education operates on a proprietary platform, which was specially designed for our purposes. We offer close to 40 audio and written courses ranging from the standard of care and better documentation to specialty case studies and our unique office staff risk management module. Our material can be accessed from our homepage or via a link from our customer's website with usernames and passwords which can be customized to meet the customer's preferences. This operating platform also provides us with the ability to report numerous aspects of learner participation. Administrators can track the details of learner participation, progress, and completion.
The website is set up just beautifully, and it's so easy to get to the presentations, and they're set up in tracks so that even if you have to leave, log out, log back in again, you know right where you were, you really don't lose much time.
You know what, you're a multi-dimensional person now seeing a patient, you got to deal with their emotional, their social needs, and also there's legal needs that surround you, and you created this covenant with this patient that you have to sort of protect yourself, but also protect the patient, and protect your staff and the corporation, and these are skills you need that you never got in medical school. And so one by one, the modules give you those skills, and hopefully over time you've accumulate that, then you can use those readily in practice.
Many CME courses I sit and I listen to, but Dr. Cotton has a great sense of humor and I really can apply it, and it makes me want to go through the whole case to the end. I don't really want to shortcut it because he makes it fun.
For those with more advanced interest, we customize and report multiple details of learner participation, including grouping by specialty, location, time spent on each module, quiz scores, evaluation scores, and learner comments.
A lot of people talk about the law, but I talk about it in a way that physicians can use.
Risk management education is the centerpiece of loss control efforts. Law and Medicine offers the most scientifically sound, legally accurate, and clinically relevant risk management training materials. We believe that we can help you prevent numerous medical malpractice lawsuits, but our materials will provide a good return on investment if we help you prevent just one.